Hi everyone, welcome to week 9 of your Pharmaceutical Career Planning 2 course. This week we're going to be covering Chapter 17. Chapter 17 is all about kind of things that are a little bit out of the ordinary. So some advanced roles that you might see in pharmacy as well as what we think might be happening in the future. So here's just a brief little overview. Typically when we think of an advanced role in the field, it's going to require some higher level of experience as well as training. Every state board is going to have their own regulations regarding that, but there's going to be some sort of higher level of education required. And then, of course, obviously, depending on what you're going to be doing, you have to make sure that you practice within that scope of practice. Here, a lot of these things are going to go past what we're typically doing. We're not going to be counting pills or, preparing creams and ointments. There's a lot more to it. So as far as a pharmacist role goes, they're going to be much more deeply involved with patient care. They're going to be providing immunizations. You may have already see that in things like in Walgreens, CVS, where they have these clinics where they're out there taking care of patients already. Disease management. So again, that kind of goes along with medication safety. So looking at their disease state, maybe they're diabetic. Let's look at everything that's going on with them, not just what they're taking as far as their insulin goes, something like that. Vaccine procurement. So a lot of, especially retail pharmacies, are offering vaccine programs within their facilities. Informatics, which is all about data. So what do we do with the data? How do we crunch that data? That's actually that's what I do in my other job. I'm a data cruncher. So I look at trends. I look at what's going on in the world. I, look at, how can I maximize purchases for my particular members of the GPO that I work for and things like that. Medication safety. And then as far as a pharmacy technician goes, we're there to help support all of those pharmacy roles. A lot of resolution with third-party billing is something that you'll see in every single aspect of pharmacy. So not only are we talking about, making sure that we get paid for our prescriptions that we're filling for patients, but since they're going to be doing medication management, we're going to be looking at that consulting piece of it. When that pharmacist is talking to the patient, they're going to be billing insurance for that disease management consultation type of thing. So making sure that we're handling the third-party billing for that is important as well. Reaching out, doing authorization for refills. A lot of states are offering something called Tech Check Tech, transferring prescriptions from one pharmacy to another. Supplies, being a buyer in a facility is a full-time job. So depending on, where you work, there's definitely opportunity in that role as well. So they're going to kind of go through in this chapter and talk in detail about some of these specialized roles. But again, keep in mind that a lot of these are just they're going to require more education. So for those of us who are lifelong learners and are excited about that, we can go out there and we can do more. So, these are just some specific examples of some of the roles of pharmacists: operating room, ER, oncology, pediatric, geriatric, traveling medicine. And then when you think about the pharmacy tech, one of the ones that I find most fascinating that they actually don't have listed here is pharmacy techs in the ER. And a lot of times what they're going to be doing is they are there to help identify and take histories from patients as far as what medications are they already taking. They might be doing almost some detective work on those patients. Maybe a patient comes in and is unconscious, but they found something in their pocket or something like that. They can actually do the research, find out what that particular drug is that patient's been taking. So lots and lots of different interesting things out there. I would recommend that you think outside of the box. Definitely working at a Walgreens or a CVS or something like that, a local facility or retail facility is a great place to start. But as far as I'm concerned, it's always great to expand your knowledge and reach out and find something new and different. So this is a great chapter for that. So as you go through it, if you have any questions about any of these unusual rules, please make sure that you reach out and let me know. And have a great week.